Morning, Miami. This is Huang with Hands-On Therapy Services. Hope you had a great weekend. How was your weekend? Latricia, how was your weekend? Did you have a good weekend?
It was great.
Good, awesome. I had a good weekend too. I was very busy with the family, just getting some time at the pool with my niece and just doing stuff around the house, which we all do. But tomorrow is going to be 4th of July, so that's really exciting. Everyone's going to be partying it up a little bit more, doing barbecues, doing fireworks, which is always a lot of fun, but very dangerous. You definitely need to be careful and make sure that you are being careful with your hands and making sure that you follow the instructions. There's those instructions, they seem really silly, but the number one body part to get injured when playing with fireworks are your hands and fingers. Actually, about 33% of injuries occur to the hand and fingers when playing with fireworks. Do you guys remember that I think it was a couple years ago, there was a football player, Jason Pierre-Paul, with the New York Giants. He was messing around with some fireworks and blew up like two of his fingers. I believe it was two of his fingers. But just messing around. I mean, they're a lot of fun. I personally love fireworks. We're going to be going tomorrow to see my sister-in-law who comes into town, and we're going to stay out there and watch the fireworks on the water. And it's fun and all, but just gotta be careful a little bit. So because hands and fingers are the most common injuries that can occur during fireworks, so just make sure you light it up, throw it away. Throw it as far away as possible so it doesn't blow up in your hands. And I don't know, I always feel like if I light it up and I'm not really sure if it lit up, just leave it there for a little while. Just leave it. Don't let me go look and see, boom, and it blows up in your hands. But anyway, so that's my public announcement for 4th of July. I wanted to talk to you guys also about some, just make sure I'm available to you let me see if there's anyone here. I still haven't really figured it all out, but I'll figure it out one day, so I can chat with you if you're watching. But I wanted to make myself available if anyone had questions regarding some hand issues, or just common questions that you could have regarding your pain in or little, whether it be an injury that you had and you had surgery, or just some generalized pain. I know every time I go somewhere, whether it be a party or at the bar, everyone, I used to go around and when someone asks, "Oh, what do you do?" I would assume, when you're young, I would assume the profession of my friend, versus saying what I am. But now I'm like, nobody's got time for that. I'm too tired. So I just say, yes, I'm an occupational therapist. I'm a certified hand therapist, and they always ask, well, what do you do? So what we do here is we help people with arm and hand injuries to become active, pain-free, and avoid surgery. And if you've had surgery, then we help you to become active again, pain-free, and avoid complications from your surgery to make sure that you can get well. So if there's anyone has questions, let me see if I can figure out how to mess around with this stuff. No, I still don't. You put on a mask to give yourself a fun look. That's okay. I already look funny. That's all right. All right, well, all right, so one of the most common questions that I get is, have you worked with my injury before? So as somebody who is a certified hand therapist, I have been working in hand therapy for almost 20 years, and to become a certified hand therapist, you have to have at least 5 years of work experience in working with arms, shoulder, elbow, wrist, and hand. Not just hands, but the whole arm. And you do have to know a lot about the neck and all the nerves that come out of the neck because they affect the hand. So you have to have at least 5 years of work experience and like at least 4,000 hours in working with arm injuries. And then after that, you take a board certification. Once you pass your board certification, then you now are a certified hand therapist. And all that means is that you devote your time and education into just keeping up with learning about everything that's new and of the arm. So as an occupational therapist, I have to have my license, and every 2 years I renew my license. And I have to have a certain amount of continuing education to keep up with what's going on in the realm of helping people recover. So as a certified hand therapist, I devote even extra time and take continuing education classes that are devoted to learning and keeping up with all the different types of arm injuries that can occur. And there's a lot of them. So when people ask me, have you worked with my injury before? Majority of the time, I can say yes. There are a lot of different types of injuries, but I have the benefit of being older, having years of experience. So I have had the privilege of working with exclusively with different types of arm injuries, and I was very fortunate to have worked at Mount Sinai for a long time, where I got a lot of my medical experience. But so when people ask, have I worked with their injury, just look at their injury, and what I do is I talk about what they're coming in for. So I ask them, they'll say, come on out, stop hiding in that background. You can come out. Hi, Dilsey. Good morning. How was your weekend? Well, because I have to do it now. Otherwise, I won't do it. The day gets really busy, and I procrastinate just like everyone else. So if I don't do it now, I won't get to it. So I want to be able to answer, a few questions in the morning. Can you help me figure this out? Like, sometimes you're supposed to see like who's watching, if anyone has questions. No? Yeah, but I can't see it. Come help me. Come help me. Dilsey is right here. Where? What'd you do? I touched this. But that just lets me write a comment.
Well, this is not like Instagram.
I'm not trying to be Instagram.
No, I know,
this
but
is
this
Facebook Live. They're supposed to, ask questions. Stop touching my face.
Probably so early in the morning, nobody's watching. The one person watching.
There it is. Well, that's okay. If I just want to see if they have questions.
You have no one watching.
That's all. Thank you. I have absolutely no one watching. So I will keep talking.
I don't see any questions.
No, that's okay. All right.
Bring the phones in.
Oh, but now I see what you did. You just pressed up there, and now we can see it. Okay, so what was I saying? What was I talking about before you completely interrupted me? So as a certified hand therapist, what I like to do when I have my patients come in is, we talk about what's important to them, what is it that they are now not able to do because of their injury, and what we can do to help them to get back to the things they love doing. And I do encourage, if you are watching and you're not in the Miami area and you're not sure about who you are supposed to go to. Actually, I have somebody who's coming to me now. He's only coming to me for a week because he's in transit. He was moving from South America, stopping over in Miami for about a week, staying with us to get started in his hand therapy, and then he's actually moving to another city. And in order to help him, because I know a lot of different therapists in different areas, but not always in the area that you're looking for. But so I what I usually do is like to recommend where they can look to find another certified hand therapist that has experience in working with the type of injury that they have. So a lot of times I encourage people to go look at htcc.org. It's the Hand Therapy Commission that credentials us for our certified hand therapy designation. And on their website, htcc.org, you can put in the zip code of where you either live or work, and it will tell you the closest certified hand therapist, and then you can call and reach out to them and see if they can help you get started or continue in your therapy. So that's what I did. He's just staying with us for a week. He's coming every day to get his hands and wrist moving, and then he's off this week to get started in his new career in New York. So that's what I recommend. And if you are looking for a certified hand therapist to work with your specific arm or hand problem, then I definitely encourage you to do that. All right, so that is one of the most common questions that I get. Have you worked with my type of hand injury before? And that's a great question to ask your certified hand therapist. You know, it doesn't matter where you're going. You want to make sure that if you're coming in with a specific, you know, arm problem, that's what they do all the time. You don't want to go to, you know, you don't want to have a hand problem and go to, you know, necessarily a foot person. You want to go to someone who specifically can help you and get you active, pain-free, and you know, avoid any complications. And then my public announcement: have a great, safe 4th of July. We are open all day today until about 5, and then no drinking and driving. And don't blow off your hands. What else, ladies? What else? What other public? But you know what? You have a great time. Have a great time. Lots of sunscreen on your face, on your shoulders, all over. All over, okay? Just lather. And, you know, most important, you know, have a good time. All right, and we're going to be closed for 4th of July. All of Tuesday we're going to be closed. If you have questions, though, please reach out to us. We are always available for you on our website, handsots.com. There's a chat option for you to talk to us. We do have a text number, which I can never remember, but if you look on our website, handsots.com, we have our text number on there, our phone number on there, and you can contact us anytime, even when we're closed. Leave us a message. All right, thank you. Have a great 4th of July.